So Dr. Smith, after a patient has gone through bariatric surgery, medication management, how does that change?
That's a great question. A lot of patients will come to us for bariatric surgery because they have obesity-related medical problems, and they're interested in being able to come off of those medications. So when patients come out of the operating room, if they have high blood pressure, we will restart their beta blocker medications, but the other medications we usually hold. And then we watch patients for 2 days and see what they need. If they demonstrate that they still need extra blood pressure medication, we'll add it back on. And this is true for all weight-related medical problems. It includes diabetes. It includes high cholesterol. We send patients home on a regimen that makes them stable in the hospital, but then they're going to go on to lose a fair amount of weight. We ask patients to monitor their blood pressure and their blood sugar and to call their primary care doctor if those things look like they're changing. A lot of patients will go on to need even less blood pressure medication than they needed when they left the hospital. And it's a good idea to call your primary care doctor if you find yourself being routinely lightheaded. If you keep standing up and feeling like the room is swimming, then you probably need less blood pressure medication going forward. Also, this is true for diabetes medication. As your weight comes off, you may need less insulin or less oral diabetes medication moving forward. And we ask you to work with your primary care doctor in order to titrate that, slowly bringing those medications down and monitoring your outcomes.
But it's important to stress, it's like, don't take it upon yourself. Allow the specialist, read the blood work, and we'll take care of this over time. We'll manage it over time.
That's right. Some patients will take it upon themselves simply to stop their medication, and that's not a safe approach. We really want patients to do this in collaboration with their primary care doctor. A great example of this is cholesterol medication, especially if your medication ends in the word statin. We know that patients often will have their cholesterol come down after bariatric surgery, and we are thrilled and we want that outcome. However, there are studies that show that if you suddenly stop your statin medications, then you'll be at higher risk for a heart attack. So we don't want you to suddenly stop your
that's
cholesterol
not a preferable
medications.
outcome.
No. We really want you to keep taking your medications as prescribed and collaborate with your specialist care doctors in order to bring those medications slowly down over time.
Hey folks, connecting with your benefits is our primary mission, and the SITREP is providing more options than ever.
Subscribe to our free email newsletter, subscribe to our audio podcast channel, or subscribe to our content on YouTube.
For details and links, check out the description below.